Tate Chronicles now transmitting.
Welcome to the Tate Chronicles on Healthcare Now Radio. And now, here's your host, Jim Tate.
Good day, citizens of the free world, from border to border, coast to coast, and to all the ships at sea. I bring you a warm welcome. This is your correspondent, Jim Tate, and thank you for tuning in to the Tate Chronicles. Join me as we explore the leading edge of healthcare delivery, technology, and culture. I'm really pleased my guest today is Brian Rovito, the Senior Account Executive at Mango Languages. Brian, thanks for joining me on this episode of the Tate Chronicles.
Absolutely, Jim. Thanks for having me.
Brian, in my prior experience, language could be a gigantic barrier. And I know Mango's involved really in the full sweep of language barriers and overcoming those barriers. But today we're going to maybe focus on the healthcare side of things. If there's trouble with communication, probably no place is it more dire than in healthcare. So let's talk about that a little bit. How does Mango Languages and the services address these barriers in really healthcare communication?
Yeah, absolutely. I'm happy to talk about that. So, as you probably know, or are at least vaguely aware of, about 22% of U.S. residents over the age of 5 years old speak a language other than English at home. So their primary language, that's almost a quarter of the country, primary language is a non-English language that they speak at home. So that doesn't mean that they don't speak English. That just means that they're more comfortable speaking their native tongue, right?
Sure.
Almost a quarter of the country. So you have to assume that then trickles down into the population of people that are coming into healthcare facilities, hospitals, et cetera, right? And about 9% or somewhere in there, I've seen a couple different statistics, anywhere between 8 and 10% of people are classified as limited English proficiency. So that means they struggle, or at least struggle somewhat, speaking English. And so when you come into a healthcare facility, that's 1 out of every 10 people nationwide that are going to be either struggling with English or at least maybe not as comfortable in English as they are in another language, their native tongue, maybe, right? So, and there's a ton that's been done, especially over the past, I would say 50 years or so, in terms of legislation and laws to give those people equity of access to healthcare. So it's certainly, we've come a long way in the past few decades, but the things that have been addressed are oftentimes, especially when we look at a language other than Spanish, because Spanish speakers are prevalent. Many healthcare facilities will have Spanish speakers on staff that can help with communication. But a lot of the other services that are provided are either translation or interpretation services, and many of those, and these are great services, by the way. I don't want to offend any companies that do this out there because they're necessary, but a lot of what they're doing is either translation over a telephone or machine translation, things like that, where I think you lose a lot of the human element that a lot of healthcare providers want to provide and connect with their patients. So I think that's where language learning, which is what Mango predominantly does. We don't do translation. We don't do interpretation. There are plenty of services, especially healthcare direct related services, that do that really well. What we want to do is teach employees, and in this case, teach healthcare workers how to communicate better with their patients, even though legally and, of course, it's important for accuracy to have those translation and interpretation services involved. But even if you can speak a little bit of that patient's language, that's going to really, I believe, and we believe, it's going to increase and better their experience. It's going to better their connection with your organization, your reputation, et cetera. So I think speaking even a little bit of a language can help a healthcare provider, whether that be doctor, nurse, or staff, connect better with patients and improve their experience.
Ben, I was in China last winter, and it was easy for me, relatively easy, if I was in a restaurant, to point at a picture on a menu to let them know that's what I wanted to order. But if I had a medical crisis, the ability to communicate and receive information back and talk about my symptoms, any of that kind of stuff, I'd be at a loss.
Yeah.
So there are obviously areas where this is certainly more relevant, and healthcare, and probably areas around legal things and court and stuff like that, really important. So it is so Mango, what Mango offers, tell me if I'm correct, is really a kind of training / educational thing for healthcare workers to become maybe not fluent, but able to communicate somewhat with patients.
Yeah, absolutely. So
Okay.
the whole idea of the work that we've done and want to continue to do in healthcare is to help improve that patient experience and to help connect as I said, improve that connection between the healthcare worker and the patient. And so what we do as an organization, Mango has both self-paced language learning services that people can subscribe to. They can use them online. You can customize them with specific healthcare vocabulary and healthcare phrases that you want to learn, and you can study on your own. And then we also have organizational language training where we do online, live, either one-on-one or small group training with people at different facilities where they can really customize it and get what they need out of it. And maybe I can give you an example.
Please.
I don't want to use any organizations' names because I did fail to look up whether I'm allowed to mention them before that. But
No
we've worked with a number of really large, well-known healthcare providers. The particular one I'm thinking of is in the state of New York, so I'll say that, but I won't give any name. And they have, obviously, they're in New York City. They have tons of non-native English speakers coming in. The two languages that were most prevalent were Spanish, of course, and Mandarin, both Mandarin and Cantonese Chinese. So two dialects of Chinese. And their nursing staff had a protocol where they were meant to ask patients when they did their rounds. There were 5 Ps. I can't remember what all 5 of them were. I'm going to try. One of them was placement. So is everything, is your phone close to you? Is your water cup close to you? Position. So is your body position correct? Or pain is another one.
Okay.
Potty, do you have to use the restroom? Can we help you with that? And there was one more. I can't remember what the 5th P was. But they found that with their English-speaking patients, these were getting checked every single time. But when you had either a non-Spanish-speaking nurse or a Chinese-speaking nurse checking on a patient that spoke that language, they'd just poke their head in and they would say, "Are you okay?" And the other person would say, "Okay," because there's no communication there, right? So what we did was we engaged with that organization to build them some services that, at the very minimum, help their nursing staff be able to interact with those patients, to ask those 5 things and understand some of the most common answers. So obviously, yes or no, and I'm thirsty, I'm hungry, things like that, so that they were able to communicate better with those patients. And it was part of a larger initiative that they had going to improve their patient-centered care scores. So as you probably know, there are tons of surveys and things that organizations do. The one I hear most often is HCA, HPS. Are you familiar with that?
Sure, absolutely.
Yeah. And I know, and again, I don't claim to be an expert. I know you are, and probably a lot of the listeners are. But I know there are like Medicare and Medicaid reimbursement and funding that are tied to those scores.
And really, they're like patient satisfaction scores.
Absolutely.
Yep.
Yeah. Yeah. So those patient satisfaction scores are important on a few different levels, I think, because number one, there's some funding tied to it. Number two, reputation of the hospital, right? Because we all read online reviews for everything we do now.
Sure.
Reputation of the hospital or the doctor or the healthcare provider, whoever, whatever, we're talking about, that reputation is really important. And people that are not necessarily English speakers are leaving reviews and reading reviews as well. So having those patient-centered care scores improve was a huge initiative for them. And they had, I can't remember what the other things, there were 5 things that they did. Language learning and tackling that specific problem was one of those 5 things. And they were able to raise their score significantly over the course of the 1-year engagement that we did with them.
So I know we're talking basically about language and medical language. What about, some aspects of language have to do with cultural training or cultural competency, things like that.
Yeah.
Um, could you speak about that a little bit?
Absolutely. So there is like a whole suite of services that is available that focuses solely on cultural competency. Our core competency at Mango is language learning and language training, but we do understand that there is that cultural piece to it. A very rudimentary example that I always use is, do you speak any Spanish, Jim, or no?
No.
Okay, so buenas tardes means good afternoon in Spanish. But in many Latin American countries, you might say buenas tardes at 6 p.m., 7 p.m. But if you're learning English and you learn good afternoon and you use that at 7 p.m., people are going to think you don't know what you're talking about, right?
Okay.
So that
Sure.
kind of cultural piece we do build into our language learning through cultural notes in the software. We use a lot of articles, songs. We have a suite of tools that you can use to consume authentic resources to get that cultural piece. But there are plenty of good. I mean, if anyone listening wants to know a couple of companies, I'm happy to recommend them after the call again, or after if someone wants
Sure.
to contact me. There are companies that do, cultural assessments that can assess your team. That isn't something Mango does, but assess your team and find out where those cultural gaps are, or assess, your patients and your team and see where those cultural gaps are and fill those in. So there are some really good tools. I mean, I think again, because I'm not directly in the healthcare space, it's difficult for me to speak on, but I know there are certain cultures, before we jumped on today, we talked about how I lived in Japan. Japanese people, and I don't want to stereotype, but it's sort of an archetype, tend to be more reserved. So they might not be as forthcoming as me or you with an American background about healthcare challenges or pain that we're in or things like that. So even those small cultural differences can make, I think, a huge difference in their experience.
One of the things I'm curious about, and let me create a scenario and get your thoughts on it, Brian. So maybe in a large hospital system, if you were going to set up Mango languages for them, people perhaps in the operating suites, it's not going to matter. Anesthesiologists, if they have a little conversation before surgery, it might be good. But those people in the OR suite, maybe it's not quite as important as in the emergency department where people are coming in, and you need to be able to communicate with them on some level extremely quickly. So is that kind of what happens? You identify those areas that were most critical or most helpful?
Yeah, and I don't want to say, in those emergency situations, I think the translation and interpretation services that are available are great, and because there's some legal responsibility that goes along with that,
Right.
it is really important to have those in place and to keep those in place. And I don't want to say that we can replace those, but we could maybe allow someone to understand the urgency of a situation a little bit better. Let's say,
Yes.
a reception employee or someone that's checking the patient in, if they speak at least a rudimentary, like, surface level of that language, let's say it's Spanish, and they hear the urgency in the words that people are using and know, this is pretty serious, as opposed to just going through the interpretation service and having that fed through someone else.
Well, I mean, just to be able to know about 10 phrases in a common language of where does it hurt? How long does it hurt? Is it sharp pain or is it an ache? Just those kind of initial questions. So if you are, Mango Languages covers so many languages. I was at your website a little earlier today, and there's some free languages to learn. I'm from North Carolina, so it's interesting that Cherokee was one of them. I think I might go learn a little Cherokee this afternoon.
Yeah, why not?
Yeah. But how was the decision made about how many languages, how much is too many? What's the cutoff point if your population need is maybe 70% for Spanish, but maybe the other 30% is among 10 different language groups. How were those decisions made when you actually integrate and make those planning decisions?
That's a great question. And there are, I think there were a couple of questions in there. So,
Yeah.
first and foremost, we build languages based on need.
Mhm.
So, the languages that we have been requested in some capacity by a critical mass of people, right? Um, and then we build content based on that need as well. So, languages like we call them our top 10 languages because they're the most 10 commonly used languages at
Mhm.
Mango. English, Spanish, French, German, Portuguese, Italian, Mandarin, Japanese, Russian, and Arabic.
Wow.
Those are the most used languages by our users.
Mhm.
And so those languages are going to have more content, like they'll go further than a
Sure.
language like, I don't know, I'm just pulling one out, but like let's say Icelandic, that is less
Sure.
commonly used. So we do have 74 languages now. Um, and those are built because people were asking for them. And the content goes deeper in the languages that are more used. So in a language like Icelandic, it might just be that surface level greetings and gratitudes and goodbyes and things like that. So is for that question. But the second question is, I think every healthcare organization is different, right? It depends
Sure.
on what area of the country you're in. It depends on if you're in a rural area of the country or a city. It depends on how many of your workers speak that language. As I mentioned, I think there are plenty of healthcare facilities that have, above 50% of their staff that are bilingual in English and Spanish because they need it, right? But even somewhere, we've worked with clients in like, say, Iowa, where a lot of their staff doesn't speak a language, but maybe they have an influx of people coming in that are Spanish speakers. So the needs are going to be different everywhere. And so we allow the organizations to identify those needs as we learn about them and as we recommend what we should do. But the one nice thing about our suite of self-paced content is that you have access to all of those languages. So let's say you're a hospital and you
Mm.
say, all right, we're going to bring Mango on board. And our need is really in, I don't know, French, Canadian, and Spanish. We have a lot of patients coming in that speak
Sure.
those languages. We want our staff to at least learn some basic words and phrases in those languages. But also, occasionally we have, I don't know, a certain department that has a lot of Korean speakers coming in. You would still have access to that Korean or whatever other language. You would have access
Mhm.
to all 70 plus languages. So really, if there's a need, then your employees could learn. And another big one that we haven't touched on yet is there are plenty of hospital staff in the US that don't speak English or have limited English.
Oh yeah.
And
Sure.
allowing them to improve their English, oftentimes what I've heard from our clients is it helps them advance their career. So let's say, they're on the janitorial staff or the kitchen staff or something like that, and they're really, really good, but they have limited English proficiency. And maybe that organization wants them to grow from within, but they need to improve their
Mm.
English to do that. They can also utilize Mango's English language learning resources to help those employees. So everybody would have access to everything.
That use case right there, boy, that cuts across a lot of industries beyond healthcare. Um,
Absolutely.
do you offer specialty tracks for clinical settings, like somebody working in the emergency department as opposed to a skilled nursing facility? Probably is going to have different questions, or the ability to focus and learn things that are language functionality that is very focused on your particular workflow or that department's workflow.
Yeah, let me answer that two ways. So we
Okay.
have in our self-paced program, our main learning track is focused on communication, right? So that's going to be where you get the bulk of your actual language learning lessons is done that
Mm-hmm.
way. But we have a couple of other tools that, I don't know, you mentioned anesthesiology. So if you wanted to
Sure.
make a list of words and phrases that are germane to your work in anesthesiology, we have a vocabulary app. You
Oh,
can
yeah.
you can put words and phrases into that. it'll put it into our sort of, it's called spaced repetition algorithm, where it'll introduce it, repeat it, quiz you on it. You can add pictures to it. So a lot of people are visual learners. So you can make a list of how it could be 10, it could be 300. It doesn't matter to us, words and phrases that you would like to study. And usually I would recommend people use that hand in hand with the main learning track. So you could be learning your communication skills, but then be learning the job specific vocabulary and phraseology that you need in conjunction with that. So the two work really well together. We also have, this tends to be for more advanced learners, but we have a program called Mango Reader. And what that does is it helps us consume authentic content in our subject area, in our target language. So let's say I'm learning Spanish and I'm a doctor and I want to go to a medical journal in Spanish. And I would say at least an intermediate level. I wouldn't recommend this for beginners. But what this tool will do is it'll allow you, let's say, to go to an article in that medical journal. You can click on a word or phrase. It's going to give you that phrase read out loud. It is going to give you the English translation of that word or phrase, and it's going to allow you to add it to one of those vocabulary lists. So if I am, let's say, a medical professional reading a journal in Spanish, and I'm pretty avid reading those articles, I'm going to be able to pick up and study a ton of vocabulary that's going to be relevant to my work.
A question that just kind of popped in my mind here, Brian. So obviously, and you described some scenarios where large hospital systems use Mango languages. What about if there's a small practice somewhere with a lot of Spanish-speaking patients, and they hire somebody who knows no Spanish and just needs one person kind of being brought up to speed? Can you handle that?
Absolutely, we can. I mean,
Okay.
we've trained anywhere from one person to tens of thousands at organizations. Wow. So, our self-paced content you can buy on our website at mangolanguages.com. Okay. But even if they wanted to take instructor-led classes that are a little bit more customized, a little bit more relevant to that one person's work, we could provide that to one person. So, with our engagements for the self-paced training, we start organizationally at 10 employees, but I'm happy to help anybody at any level. So
Sure.
I can point them in the right direction. But yeah, 1, 2, 3, 10, whatever it is.
Okay. And so integration with healthcare workflows, any work underway with EHR platforms or to embed language, learning directly into workflows?
Yeah, I mean, with all of our organizational clients, we have some integrations available currently. So what we tend to do, because we're a cloud-based program, is it will be a handoff to our system, but there will be, almost all of our corporate or organizational clients will have us live somewhere within their ecosystem. So whether that be an HR system, LMS, which is a learning management system, or even like a SharePoint or something else, anywhere where they compile they aggregate learning tools or tools for their employees, we can integrate into that. And there are a few different ways that we can do that.
Hospital administrators love to see data that any technology they employ is being used and brings value. Are there any milestones or reports of how and when Mango is being utilized with a system that will please those people at the top?
Absolutely. So we have two ways that we do that as well. The first is on aggregate. So let's say you buy it for your whole hospital system. You can see how many people over a given date range. You can set that date range. How many people have accessed it, how long they've spent, what languages are most accessed with the usage statistics there. And you can see a few other things like average length of session, because if the average length of session is 2 seconds, then something's wrong, right? They're not accessing it properly. So we take a look at those type of things, and we actually have account managers on staff that'll work with organizations to make sure we're hitting benchmarks on the aggregate. And then let's say an individual has, as a part of, we've seen this, a part of a performance improvement plan, I want to improve my English, for example. we are able to track on the individual level how long they've spent in the program, and you can go as far as granular as to see like when they logged in, how long they spent, what they did, and all of our content. We haven't really gone too deep into it, but there's a pre and a post quiz or test, so you can see what they knew going in and what they knew coming out, and how much they grew as they were using the program. So definitely something that we've always kept track of, and it's huge, I think, especially when you're looking at something that's organization wide, looking at those aggregate statistics to show like, hey, we are getting that ROI that we're looking for.
That's important. Yep, that's important. Brian, we're almost out of time, but I know you mentioned the website earlier, but can you mention that again for people who want to know what Mango Languages is all about and how to contact for services?
Absolutely. It's just www.mangolanguages.com, mango like the fruit. I always say, just in case people don't hear. And then they want to reach out to me. It's Brian, BRIAN .Rovito, ROVITO at mangolanguages.com. So that's
Brian, thanks for joining us today. This episode of the Tate Chronicles. Very interesting work that you're doing. Thanks for coming.
Thank you so much for having me, Jim.
You can find more information on this show's program page at healthcarenowradio.com. That's healthcarenowradio.com. Until we meet again, here's wishing you smooth sailing and safe harbor.
Tate Chronicles transmission ending now.